Hi class, this is Dr. Shahada, and in this video I'll be going over Chapter 7, which covers social determinants of health, as well as the role of law in optimizing health. Now, the effects to improve health in the U.S. have traditionally looked to the healthcare system as the key driver of health and health outcomes. Now, with the Affordable Care Act, it has increased opportunities to improve health by expanding access to health coverage and supporting reforms to the healthcare delivery system. Now, while increasing access to healthcare and transforming the healthcare delivery system, which is very important, research demonstrates that improving population health and really achieving health equity requires broader approaches that address social, economic, and environmental factors that influence health. Now, before I go into the definition of social determinants of health, I want to go to slide 4 and really distinguish this difference between disparities in health and disparities in healthcare. So, while both terms are related, they do have different definitions. When we're looking at health disparity, it's when one population group experiences a higher burden of disability or illness relative to another group. Then we have healthcare disparity, which really denotes differences in access to healthcare services or health insurance, or in the quality of care actually received. As long as these disparities exist, a society can't achieve what is known as health equity, a situation in which everyone has the opportunity to attain his or her full health potential. Now, there's a number of different factors that can contribute to health and healthcare disparities. We have individual behaviors, healthcare provider bias, cultural expectations and differences, location and financing of healthcare systems, social factors, and more can all be contributors. So health and healthcare disparities appear through many different lenses. Researchers have documented disparities based on race, ethnicity, socioeconomic status, age, geography, language, gender, disability status, citizenship status, and sexual identity and orientation. All right, so what I just covered, I think here is on the following slide. Next, I want to go into what the social determinants of health are. All right, so let's go to the next slide here. So when we're talking about social determinants of health, they're really the structural determinants and conditions in which people are born, grow, live, work, and age. Now, according to the Centers of Disease Control and Prevention, or CDC, they're the factors that contribute to a person's current state of health. Now, despite the annual healthcare expenditures projected to exceed $3 trillion, health outcomes here in the U.S., which we've covered before, really fall behind other developed countries. Recent analysis shows that although overall spending on social services and healthcare in the U.S. is comparable to other Western countries, the U.S. disproportionately spends less on social services and more on healthcare. Now, though healthcare is essential to health, again, research demonstrates that it is relatively a weak health determinant. Health behaviors such as smoking, diet, and exercise are the most important determinants of premature death. Moreover, there's a growing recognition that a broad range of social, economic, and environmental factors really shape individuals' opportunities and barriers to engage in health behaviors. So these different factors include biological factors, then on slide 7, psychological factors, as well as social factors. Now, in the next slide, again, just providing an overview of what social determinants of health are. Again, they're the social conditions into which people are born and that affect their daily lives and overall well-being as they move through life. We already defined it here, definition by the CDC, and then as well as the definition by WHO or the World Health Organization. Now, the next two slides really describe what the determinants of health are. Here is a diagram just pretty much illustrating what the definition of the determinants of health is. And here are just examples of different health components within each determinant of health. Now, in slide 11, there's a number of different types of social determinants of health that are listed. The first one being access to high quality educational opportunities. Individuals with access to consistent high quality educational opportunities are really more likely to obtain higher income jobs and completion of undergraduate and graduate studies, which helps them get these higher paying opportunities. Many middle and high schools in low income areas, however, have high dropout rates or do not adequately prepare students for higher education. Many of these areas don't have adequate access to job training resources for those seeking training in a vocation, which can provide a path to a well-paying career in the absence of a 4-year college degree. Now, when we're talking about access to medical care services, individuals who don't live close to medical care providers, like primary care doctors or clinics or hospitals, are less likely, obviously, to see a physician regularly and will often only seek care in emergencies, leading to the overuse of emergency departments. Access is also not just about geography. It entails affordability as well. People who don't receive health insurance coverage as a job-related benefit usually can't purchase it on their own, and they forego seeing a doctor for several years before seeking healthcare services or going to the emergency room. And of course, this leads to a decreased quality of life. Now, when we're looking to access to social media and other technologies, you have the internet, cell phones, that are all becoming increasingly useful in individual and population health. From appointment time reminders, to learning more about one's symptoms and diagnoses, to buying insurance through state exchanges established under the Affordable Care Act, to finding providers who are accepting new patients. So in addition, many people connect to support groups or other valuable health-related resources through the internet. And providers are increasingly making health records available through internet portals. We also have the availability of community-based resources and opportunities for recreational activities. Community-based resources can connect residents to local health providers and recreational physical activities, both of which increase the likelihood that people will lead healthier lives overall. The last type of social determinant of health that I'm going to go over here is the availability of resources to meet daily needs. So the further an individual lives from a grocery store that offers healthy food options, like fruits and vegetables, the more likely it is that that individual will consume fast food or other relatively unhealthy options. So geographic areas that have no or few healthy food options are referred to as food deserts. Food deserts tend to be identified based on their shortages of whole food providers and their abundance of quick marts and fast food establishments that stock processed, sugar-heavy, and fast-laden foods that contribute to a poor diet and can lead to higher levels of obesity and other diet-related diseases. Now, on the next slide, there's also more different types of social determinants of health, even though in the last slide I said that was the last one I meant the last one on that slide. Here are a couple. Culture. For example, some cultures rely heavily on time-honored approaches to illness, such as teas and other homemade remedies. While these can be effective, some commonly ingested herbals can in fact be quite dangerous when taken in conjunction with other regularly prescribed medications. We have language literacy. So if adequate translation and interpretation services are not in place in healthcare facilities, foreign language speaking patients may be discouraged from seeking care. Another one is public safety. Individuals who live in dangerous neighborhoods tend to remain indoors, which can close off opportunities for exercise and social interaction. We have residential segregation. Physicians may preferentially set up their practices in locations dominated by certain demographics, which leads to some patient populations, often minority and low-income populations, suffer from a lack of healthcare facilities and resources in their neighborhoods. Then we have social norms and attitudes. So discriminatory attitudes remain a cause of health disparities. Multiple studies have shown that physicians are more likely to recommend medical best practices based on race, gender, and age. And such studies have demonstrated that bias in physicians and other health professionals still plays a significant role in how patients of certain races, ethnicities, and social statuses and educational levels are treated. And then socioeconomic conditions, which link between poverty and poor health, which is described in a lengthy manner in our chapter for this week. And then we have transportation options. A lot of individuals miss medical appointments because they don't have a way to get there, right? They live long distances and they really rely on public transportation. And it tends to be a very common reason to not access health care when needed. All right, so now I'm going to jump to slide 17. Why determinants of health? And here is just a little illustration of the impact determinants of health have on different health outcomes. It has a direct impact on health in interacting with each other to produce health, structure behaviors, and determinants of health actually predict the greatest proportion of health status variance. So when we're looking at the link between social determinants and health outcomes. So social determinants don't usually act alone. They tend to kind of impact each other. So while most diseases and injuries have multiple causes, and while several factors and conditions contribute to a single death, the overwhelming weight of evidence demonstrates the powerful effects of socioeconomic and related social factors on health. Now, based on a meta-analysis of nearly 50 studies, researchers found that social factors such as education, racial segregation, social support, and poverty actually accounted for over a third of total deaths in the U.S. And half of all deaths in the U.S. actually involve behavioral causes. Now, in the next slide, it just indicates that one of the most influential social determinants of health has to do with access to safe, quality, and affordable housing. Living in a predominantly minority neighborhood increases the likelihood of having poor access to healthy food options, as I mentioned before, with food deserts. Now I'm going to jump to slide number 21. And really throughout the nation's history, law has played really an integral part in causing, exasperating, and even alleviating health-harming social conditions, from the legally sanctioned, racially segregated medical care systems used during times of slavery, to the expansion of building codes in the 1920s, to the war on poverty legislation of the 1960s, and then ultimately to the Affordable Care Act's focus on health equity. Now, the law can be used to design and perpetuate social conditions that can have terrible physical, mental, and emotional effects on individuals and populations. Now, an example that is mentioned in the textbook is the separate but equal constitutional doctrine that allowed racial segregation in housing, healthcare, education, employment, transportation, and more prior to the civil rights movement. So racially segregated healthcare dates back to the times of slavery. Now, the law can be utilized as a mechanism through which behaviors and prejudices are transformed into distributions of well-being among populations. So, although Black and white people use illicit drugs at approximately the same rate, drug crime incarceration rates are far higher among Black people. Another example is healthcare provider discrimination and bias, which really resides in this category. When we're talking about healthcare bias or discrimination, it can take many forms. It can be based on race, disability, ethnicity, gender, age, or socioeconomic status. Class-related healthcare discrimination alone can take multiple forms. So an example of this, as mentioned in the book, some healthcare providers might refuse to accept patients, individuals who are covered under Medicaid, because the Medicaid population tends to be disproportionately poor and of color. Or low-income individuals might fall victim to the practice of redlining, which refers to situations in which healthcare entities relocate from poor neighborhoods to wealthier ones. All right, now in the next slide, laws can be determinative of health through under-enforcement. So a perfectly good set of housing regulations aimed at keeping housing units safe, clean, and quiet may be of little value to an individual or group health if there is neither the will nor the resources to enforce them. So an example of this is really substandard housing conditions, and which may include healing lead paint, mold, there may be rodents, exposed wires, or insufficient heat. And these are usually common among low-income housing units, which can actually exacerbate skin rashes or lead poisoning or asthma, fires, and other common illnesses. And then there's the law that can be used to structure direct responses to health-harming social needs that result from things like impoverishment, illness, market failure, and individual behavior that harms others. And an example of this is the Emergency Medical Treatment and Active Labor Act, or EMTALA. So now I jump to slide 25. I'm going to slowly start wrapping this lecture up. I just don't want to make it too long. But I do want to touch quickly on, or just briefly cover, MLPs, or medical legal partnerships, which is really the function of an MLP as a patient care team, which includes both medical and legal professionals. So it's a legal services attorney is literally embedded in a medical care setting, such as a hospital or a community health center. And the focus is to address underlying social conditions that negatively affect patient health, but whose remediation is outside the expertise of traditional healthcare providers. So at a more fundamental level, the goal of the MLP movement is really to help create an interconnected care system that focuses on the whole patient rather than just on the biological or behavioral aspect. So this includes a myriad of social conditions that factor into individual and population health. So the work of MLP lawyers is quite different from that of the general counsel or a compliance officer who normally inhabits hospitals and clinics. A general counsel typically provides legal advice to clinicians on matters of medical liability and informed consent and represents them in insurance and disciplinary matters. Corporate compliance officers are responsible for ensuring that the facility meets all governmental, environmental, and licensing regulations. Now, the medical legal partnership approach can be adapted in a variety of settings, and MLPs currently operate in about 294 healthcare institutions, including 45 children's hospitals and 77 HRSA-funded health centers, and an increasing number of institutions that serve veterans and the elderly. Now, in the next slide, it touches on the history of the MLP movement, which it really roots back to the late 1960s when visionary physicians, Dr. Jack Gager and Dr. Count Gibson, were actually funded by the federal government to form the nation's first community health centers in Mississippi and Massachusetts. Now, the government's community health center program actually grew out of the civil rights movement. Now, in designing the earliest centers, you have Drs. Gager and Gibson who recognized the importance of spending some of their federal funding on lawyers who assisted African American health center patients battling housing discrimination. Now, the second prominent instance of the blending of these medical and legal services for low-income populations actually occurred in the early 1980s when faced with the devastating death tolls from HIV/AIDS. Some health clinics actually began providing on-site legal assistance to patients who needed to really kind of grapple with these end-of-life issues. All right, so I'm actually going to start wrapping this up. I do want to remind you all to make sure to read the chapter and also go over I Help, which is kind of goes along in the category for the MLP approach. If you have any questions, don't hesitate to let me know. I hope you found this video helpful, and take care, everyone. Bye.